All right, this is major impairment rating considerations for the low impact soft tissue spinal injury. So when you're considering giving an impairment rating, these are the factors that you want to consider. So first of all, what's the impairment rating based on? It's based on the consultation of the patient, physical findings, diagnostic findings, and the physician's experience. So it's those accumulation factors is what you will be evaluating. Okay, all of those parameters. Now, what are the four major injury categories? Is there a mechanism of injury? In other words, when you're looking to give an impairment rating, was there a mechanism of injury, cause and effect relationship? Do you have subjective findings at MMI? Do you have at least one subjective finding at MMI? So if they got hit in the back and the neck, do they at least have neck pain at MMI? Do you have at least one hybrid finding at MMI? And do you have at least one objective finding at MMI? And then you want to make sure the patient has reached MMI. In other words, you allowed them to go through all three phases of healing, or you can kind of lose your credibility by cutting it off short. So we always say let them go through the inflammation phase, the repair phase, and the earliest that you might want to take them, call it quits and call it MMI, is when you have 2 re-exams with no improvements in the remodel phase. That would be the most justifiable reason to call it MMI. You've given them the chance to heal in all 3 phases. And then 2 re-exams in the remodel phase, there's no improvement. So you've given them the chance and now it's over. See, that's easy to justify. So you don't have to wait 12 months. So was the patient at MMI? Now we can give the impairment rating. But these are all the factors that I'm going to be paying attention to relative to giving that impairment rating.